Hello everyone. It's an honor to be here tonight presenting alongside these giants, and I think after this very nice presentation it's going to come as even more of a contrast how the situation is currently in Belgium, because if I were to make this slide for Belgium, it would be a blank slide. So now I'm going to tell you about my journey trying to set up a first study of psilocybin-assisted therapy for severe alcohol use disorder in Belgium. My name is Laetitia, and I'm freshly graduated from the KU Leuven's Master in Experimental and Theoretical Psychology, and I was awarded a research grant from the National Fund for Scientific Research to start a PhD on psychedelic-assisted therapy, which I'm starting on Monday. Just like then, I used to be a ballet dancer, not just like then, but so I had my fair, very nice. I had my fair exposure to drugs, but also I was part of a study on psilocybin assisted therapy for healthy patients, so I had also a legal experience of psilocybin. Let's start. So my conflicts of interest, as the slogan of the FNR says it, freedom to research, so there are no strings attached. And for one of the studies, we will receive low-cost psilocybin from Filament Health, but there are also no strings attached, so it doesn't influence on our results or the way we communicate them. My PhD will consist of 2 clinical trials. The first clinical trial will be with the Paris Brain Institute at the Sorbonne University. It's a study of LSD-assisted therapy for severe alcohol use disorder. It's going to be a large-scale study involving 210 patients, and it's going to be multi-centric, so across several hospitals in Paris. The second study that I will be focusing on today is a DULB with the Laboratory for Medical Psychology and Addictology. It's going to be a psilocybin-assisted therapy study for exactly the same reasons, because we wanted to go through the ethics and because the half-life is shorter, and so it's easier for therapists to sit with patients because it's not as long as LSD, and the study will take place at the Guggenheim University Hospital. So because I didn't start my PhD yet, I don't have any sexy results to share with you, but what I wanted to do tonight is to go a little bit through the process, why starting this study, what this study will entail, and also how I set out to do it, because maybe it can help people who want to set up such a study, or just people who are curious about the stand of affairs in Belgium. So first, the most obvious reason is that there is currently no research on psychedelic-assisted therapy in Belgium, although most countries in Europe and across the world have actually started. To be completely accurate, there is one study with psilocybin that's set up to start in Liège with Paolo, who is present today, but it's not the same because it's looking at the pharmacological effects of psilocybin in patients with disorders of consciousness. So it's not a psychiatric population, and it's also not looking at the interaction between therapy and psilocybin. What does that mean that there is no research in Belgium? It means that there is no expertise being built amongst researchers, also in terms of the legal aspects of setting up such a study, but it also means that there is no formal expertise being built among therapists. They are not being trained, they are not getting experience with treating patients, and if psilocybin is to become a legal tool for mental health in the future, there will be a huge shortage of trained and experienced therapists in Belgium if we don't start with studies. Why focus on severe alcohol use disorder? Why focus on this population? I fully agree that we have to, move beyond the diagnostics, because there's a lot of comorbidity in psychiatry. But in order to get a grant, you have to somehow, push the system from within. And now the grants are given often for clinical studies according to a specific condition, psychiatric disorder. And alcohol use disorder, as was mentioned, is a huge burden on society, and there is a high relapse rate. 50% of patients who do a detoxification or rehabilitation program relapse within the first month, and between 70 and 90% within a year. Then why is my study exciting, it's because it's a novel population and a novel setting. How is it a novel population? Just like here showed, there was recently one of the most recent big psychedelic research publication was of psilocybin-assisted therapy in alcohol use disorder, and showed interesting results, significantly higher rates of abstinence and significantly less heavy drinking days compared to patients treated with placebo. But this is a population, a general population of alcohol use disorder, and our study will focus on severe patients. So these are patients who exhibit more severe symptoms and are coming to the hospital to enter a 3 to 4 weeks detoxification program. That's also another difference of our study, is that this study was outpatient, in an outpatient setting, so people were just coming to get the therapy and then going back home, and then coming to get the psilocybin session, going back home. And here we want to see if we can implement psilocybin-assisted therapy within treatment as usual to change incrementally. So it's going to be patients that come for a 4-week detoxification program, and we want to see if towards the end of this program we can offer psilocybin-assisted therapy. So that, we also limit the dropout because patients are there. So what is the study going to entail? We are going to start with an open label feasibility study. That means that no one is getting a placebo, there is no blinding. Why are we doing this? For ethical reasons. Because we cannot at this point make sure that people who will be in the placebo group can receive the treatment at the end of the study. That would mean that when people enter the study, they don't know if they get the psilocybin or the placebo. And so for ethical reasons, we decided not to do that, to start and to do an open label where everyone entering the study knows that they will get the treatment. It's not as scientifically sound as an RCT, randomized controlled trial, but we are starting from there. It's going to be 20 patients who are hospitalized, as I said, for alcohol detoxification. We will look at some neurocognitive mechanisms. The grant that I got, the FNRS, it's really focused on fundamental research. So in order to get money for a clinical study, you need to also show how you are going to contribute to more fundamental knowledge, hence the focus on neurocognitive mechanisms. But my main interest is to see if we can help patients and what happens in the brain. It's nice to understand, but yeah. And the study is set up to start in winter 2023. That's what we hope for. Let's see more to come in 6 months. So this is the protocol, psilocybin-assisted therapy. PAT stands for psilocybin-assisted therapy for severe alcohol use disorder. As patients enter the inpatient care, they are screened and included if they want to participate and if they fit all inclusion criteria and do not have any of the exclusion criteria. We will assess their alcohol consumptions 12 weeks back. It's approximate to know how much they were consuming before and their craving. Now, I listened very well to Geert's presentation, and I will make sure to perhaps implement other outcome measures that are more representative of general well-being. Then, purple at the top, you see everything that pertains to the therapy. So they get the treatment as usual, that they usually get during the detoxification, but on top of that, they will get 2 sessions before and 2 sessions after the psilocybin of motivational interviewing, as well as 2 preparation sessions and 2 integration sessions. So the preparation sessions, I think maybe most people know how psychedelic-assisted therapy goes, and Ben went over it. It's mostly for patients and therapists to get to know each other, to build a therapeutic alliance, so that they can really let go when they undergo the psilocybin experience. They are also provided with tools, mindfulness, focus on your breathing, open to the experience, so that they know how to cope with whatever might come up during the psilocybin experience. The integration sessions are really focused on seeing with the therapist how they can integrate the insights and the ideas that might have arisen during the psilocybin session, and see how they can really use that in their daily life to perhaps change unhelpful emotional, behavioral, or cognitive patterns. At the bottom, you see the measures that we will have. So we will be doing some EEG, electroencephalogram, to look at changes in neuroplasticity, as well as questionnaires and cognitive tests to look at changes in flexibility, psychological flexibility and cognitive flexibility. And we aim to also, with the, if we get the okay from the ethics committee, to record some of the therapeutic session to do some more qualitative analysis. And then at the end of the inpatient care, patients can go home, and we will keep following them for 6 months to assess their craving and alcohol consumption. So at this stage, the psilocybin session is planned to happen around day 18, 30 milligrams of psilocybin, but we are looking into a possibility to add a second dosing session towards the end of the inpatient care. So that might still change. So now, very briefly, how, and actually, what are the steps to set up this study? Because there was nothing, but I was very lucky for several reasons. First, beginning of last year, I found PSBE, and I found a bunch of very competent and supportive people, and this really pushed me forward to try and put this study together. And then I was also lucky that the head of psychiatry at Brugman, who didn't know about psychedelic-assisted therapy, was open-minded enough to tell me, you can try, but you will have to find money. So that's why I applied for the grant. Now an FNRS grant, it will pay for my PhD, but it doesn't cover all the operating costs. Within the FNRS, you can apply for other grants that will cover some of the operating costs. We also are working with the Brugman Foundation, which is connected to the hospital, so there is some money there. And we actually also created a foundation to try and raise private money, not only rely on the governments, because what happened in the UK and in the US, most of the early funding for this type of research was philanthropic. I know that PSBE is also keen on supporting research with financial and other resources. Then find the drug. So you cannot find the drug on the dark net for this. You need GMP, so good manufacturing practice, psilocybin or LSD or MDMA. This can be very expensive. We were very lucky to collaborate with Filament Health, and I know Paolo is too, which is a public company that's providing researchers for clinical trial with very low-cost psilocybin. They did find a way to patent their psilocybin because they have this natural extraction process from actual mushrooms. So, I mean, of course, they have an agenda in mind, but that's very generous of them. Obtain approval. In Belgium, you will need 2 main approvals. You will need the ethics committee approval from an independent ethics committee. And here you have to really be able to explain how you will be managing the risk, or should I say the safety profile of the drug. And then you will also need approval from the Federal Agency for Medicine and Drug Products. Last thing is to build the expertise, because it's very important if studies are going to happen in Belgium that they happen well. We are talking about vulnerable population, you know, people who have undergone trauma and others. And psilocybin or classic psychedelics are very potent, powerful compounds that can, you know, lead to challenging experience. So people need to be held, cared for, supported, feel safe. So when I say build expertise, I refer mostly to trained therapists in the right way. For this, we are collaborating with Peter Gasser, who is a psychiatrist, a Swiss psychiatrist with a lot of experience in psychedelic-assisted therapy, and Mathieu Senard, who is a Belgian psychiatrist working on the psychedelic trial team at King's College London. They will be training the therapists in the hospitals and supervising them throughout the study. Actually, one of the main therapists for the study is here tonight with us, Felix. Okay, do I have time or not? Because
Louise? Yeah.
Just 2 slides.
Go for
yeah,
it.
I don't want to I want people to be able to ask their question. So this is something I just added this week. Last week I was at the ICPR, the Interdisciplinary Conference on Psychedelic Research, and it's a great conference. I mean, there's like 100 speakers, 3 days. But what was really interesting is that they gave a voice to former participants of psychedelic-assisted therapy studies. 2 of the speakers were Jan Rouillet and Leonie Schneider, who both took part in psilocybin-assisted therapy studies at Imperial College for treatment-resistant depression. And that's something we tend to forget. You know, we want to help patients. That's why we are setting up these studies. But what's their experience and how can we learn of their experience. And they have set up the Psychedelic Participant Advocacy Network, where they offer consulting for researchers that are setting up new studies in order to really see how they can build studies where patients are at the center of the protocol. So we hope to collaborate with them. And I will just briefly outline 3 main points that they mentioned and that I thought were important. Fair access and compassionate screening. So to take part in such study, for instance, the MAP study, apparently it's like 100 pages of questionnaires that you have to answer. You are in a screening process for 2 months. You don't know if you are going to take part in the study, and you are in a mental state that's not good, right? That's why you want to take part in such a study. This is something we really want to reduce in our study by having, during the pre-admission, already psychiatrists see if patients fit most inclusion criteria and only offer to take part in the study if there is already this sort of pre-selection, and not burden patients with tons of questionnaires to fill in order to maybe be able to take part in the study. Fair access, we are going to include patients that enter inpatient care at the Brugman Hospital. It's a very diverse population coming from all sorts of academic background, but mostly the lower end. Safeguard treatments, that's very brief, have the best possibly trained therapists that are really going to be able to make patients feel safe and healthy. Aftercare for all, that's a very important point because, of course, there's integration after the dosing session, and there is a follow-up. We call patients up, did you drink, are you still depressed? But actually what they were explaining is that once you take part in such a study and you go back to your family that maybe doesn't have a psychedelic experience, you don't know the other participants, and you don't have access to a psychedelic community, it can be very difficult to sort of move on, And so, as was mentioned today, the system also has to change, and we can somewhat change the system if we are not politicians through community building. And that's one of the main things I hope we will be able to set up, is to start by setting up integration circles, and probably in collaboration with PSBE, because I know that's also one of their plans, where participants can go following taking part in the study, in the months thereafter, maybe in the year thereafter, and meet up with other people with psychedelic experience and discuss their experience and feel like they are part of a wider community. I will end. I was talking very fast because I didn't want to take too much time with acknowledgement. So what has been very nice setting up this study is that most of the psychedelic researchers I was reaching out to answered my request and offered their help. At Imperial College, King's College London, Mind Foundation in Berlin, and the University Hospital of Geneva. Then I also want to thank PSBE, because I really don't think I would have had the courage to start all of this if I had not become a member of PSBE a year ago. And of course the FNRS for granting me some money, and the VLD and the Sorbonne University for supervising my project. Thank you.